Hello, I'm Bobby Robbins, president of the University of Arizona. The economic effects of the COVID-19 pandemic are broad-reaching and changing every day. Today, I'm pleased to introduce two University of Arizona experts who will share some perspective on this important topic. Price Fishback is an economic historian and the Thomas R. Brown Professor of Economics at the Eller College of Management. George Hammond is a research professor and director of the Economic and Business Research Center at Eller. They are joined by Alice Bonaime, associate professor and Philip Rhodes Fellow in finance at the Eller College. Alice will moderate this discussion. Alice, take it away.
Thank you, President Robbins. Good afternoon and welcome participants. Thank you for joining us for this important and timely discussion about COVID-19 and the economy. Joining me today are Dr. George Hammond, who is an expert economic forecaster, and Dr. Price Fishback, who is a renowned economic historian. Each of our panelists will begin with a broad overview of the impact of COVID-19 on the economy. Then we will move to Q&A, beginning with questions submitted prior to today's panel, and finally moving to questions that you submit throughout the discussion. So we encourage you to submit questions using the Q&A function. George, would you like to begin?
Yes, thanks, Alice, and welcome everyone. It's nice to see you all here at this event remotely. So we are in the middle of really unprecedented times, and one of the things to keep in mind, particularly as you see economic forecasts for how things may play out over the next weeks and months, is that there's a huge amount of uncertainty, particularly around any projections for the future. And what's driving that uncertainty is the outbreak itself. We know a lot more about the virus now than we did a couple of months ago, but there's still a lot more to learn. So how the outbreak progresses in coming weeks and months will have a really big impact on how the economic recovery will progress. You also want to keep in mind that there's a lot of uncertainty about how individual consumers and employees will react as we begin to open up the economy. And that's really going to be one of the key drivers. Even once the government steps back and allows restaurants, bars, sports stadiums, movie theaters to open back up, there's a lot of uncertainty as to how workers and consumers will react to that. Will we go back to those places to the same degree that we did before the outbreak? So one key thing to keep in mind at this time is that there's a lot of uncertainty about how the future is going to play out. And one thing that we know for sure is that the global, national, and Arizona economies were in good shape before the outbreak began. In terms of job growth, Arizona added about 80,000 net new jobs last year for 2.8% growth. That was double the national rate. Phoenix grew at an even faster pace last year, and even Tucson added jobs at a faster pace than did the nation in 2019. And in fact, Tucson's job growth last year was the fastest that we had seen in more than a decade. So the economy was in good shape before the outbreak began. But what the outbreak has caused is essentially a sudden stop to the global, national, state, and local economies. And we're seeing indicators really across the economic spectrum that you really haven't seen in decades, going back to the Great Depression. In terms of the labor market, Arizona has seen 550,000 initial claims for unemployment insurance. These are really phenomenal numbers. Nationally, over 36 million initial claims for unemployment insurance. We do have some national data now for April. And the April employment situation report showed that the U.S. unemployment rate spiked up to 14.7% with over 20 million jobs lost. The employment to population ratio for the prime age Population fell to levels that we last saw in the mid-1970s. Now, Arizona, we don't have that April data just yet. That will come out next week. But what we do know is that the Arizona unemployment rate tends to track the national rate fairly closely. So I think that next week we're going to learn that Arizona's unemployment rate is up in that 14 to 15% range. Now, the sudden stop is hitting and affecting all industries across the economy. But really the epicenter is in sectors like travel and tourism, retail trade. In somewhat of a surprise, we're also seeing major job losses nationally in the healthcare sector. In addition, hotels or hair salons, nail salons, childcare has also experienced big effects. And the rest of the economy is going to feel the ripple effects as those shocks spread through the economy. So we've experienced a big hit. The big question now is, what will the recovery be like? And this is where you're really hearing kind of this alphabet soup of letters being used to characterize what might happen over the coming weeks and months. So when you hear someone talk about a V-type recovery, that's kind of the most optimistic scenario. That generally means a very rapid return to the level of economic activity that we last saw before the outbreak. So most of the forecasts now that are characterized as a V-type recovery would have us back to where we were sometime in 2021. The other type of recovery you're hearing about is the U-type recovery, or some people call that the Nike swoosh recovery. And there what we're thinking of is a recovery that takes longer to gather steam and longer to get back to that prior level of activity. Most of those have us back to 2019 levels sometime in 2022. Now, the least optimistic take is an L-shaped recovery, where it might take 5 years to get back to 2019 levels, and a W-shaped recovery, where we might experience a resurgence of the outbreak as we get into the fall and winter months, and that requires a whole nother round of shutdowns in the economy. And that's probably the least optimistic or most pessimistic scenario. Now, my forecasts for Arizona, which were released in early April, are along the lines of a Nike swoosh recovery. We are going to start to recover, probably are recovering now. We will see consumers and firms start to open up, consumers going back. But I think it will take some time for us to repair the damage that's been done, just because the hole is so big. So I currently see Arizona getting back to that 2019 level sometime in 2022. So the punchline here is that we've experienced a big shock. The state, national, global economies were in good shape before the outbreak. That puts us in pretty good shape to generate a recovery, and we will be back to where we were in the 2019 period sometime in the next couple of years, as long as we can avoid those most pessimistic scenarios. So with that, I will throw it back to Alice.
All right, thank you, George. Very helpful. Price, I'd love to hear your take on how you see COVID-19 having impacted the economy.
Thanks, Alice. So the one thing to point out about this is that there's been a very strong government response to this, and it's actually probably much larger than we've ever had any time peacetime economy we've experienced. And one of the strangest things that happened this week was Nancy Pelosi announced that the House is going to seek to add a $3 trillion stimulus to the process. Now, if they do that, what's going to happen is that the government spending response is going to be somewhere in the neighborhood of where we were, or actually larger than what we were doing during World War II, when we were fighting an all-out war. So I have some suggestions about a more targeted government response that allows the economy to open, and so I'm going to make some of those while I go along. So you already know that state and local governments shut down the economy. What's new about this, and what's different from what happened with the Spanish flu in 1918, is that they shut down non-essential businesses. Back then, they shut down schools and all sorts of large gatherings and things like that. We're doing the same, but we've added a lot of businesses as well, which has shut down big sectors of what's going on. Now, the federal government and loans so far have been designed to be short run. The idea was, this is emergency. We want to allow workers and businesses to maintain connections. And what you want to do is prevent sound businesses from going bankrupt. And you want landlords and tenants, or landlords and lenders, to allow delays in repayment, so forbearance. Now, if all those connections are maintained, we might have the V-shaped recovery that George talked about. It's looking a little bit more dim than what it was. It might be more swoosh-shaped, like George said. But one of the biggest problems is if you start to break those connections, people are firing workers permanently, companies go bankrupt completely, then you have to start from scratch. And now things are going to be really bad. And you could have a much worse situation than what you expected. So here are the new and unusual policies that the federal government's been involved in. So there's unemployment insurance changes. The states have suddenly allowed workers who were hired by employers who did not contribute to the system participate. So that's very new. The federal government also has tossed in an extra $600 per week to add to the normal benefits through the end of July. Now this raises the benefits above the weekly earnings of some of the people who have lost their jobs or who are laid off. Now, one of the reasons to do that is it helps pay for health insurance if they're not being covered during that time frame. But this is going to create a problem, and already probably has been creating problems for getting people back to work, because who's going to go back to work if they're getting paid 130% of the normal wage not to? Now, there's also the Small Business Protection Plan. You've seen a lot of discussion about what's going on there. This is an incredibly generous loan program. They require no collateral. The current interest rate's 1%. They allow payment to be deferred by 6 months. You don't have to repay it if you spend at least 75% of it on the payroll. They also have available other loan programs that are not quite as lucrative. In addition to this, we have the economic impact payments. And this is a payment of $1,200 per adult and $500 per child to about 90% of all taxpayers over the last year. There are also tax breaks for businesses and for some individuals as well. They're going to add up to about 3% of GDP. And another 2% of GDP is being offered to state and local governments in the form of grants and loans. So this is a pretty hefty amount of money that's being spent and laid out there. So let me give you some ideas of where this sits in terms of money. In 2019, the GDP, which is the output in the economy, the value of goods and services in a year, was about $21 trillion. That's a really big number. Who knows what that means? So what that really is $67,000 per person. That's our per capita income. Federal outlays last year was 21% of GDP. Okay, the previous peacetime high was 24%. We reached that back in the Great Recession in 2008 and 2009. Now, so what the current Congress stimulus, the one that we've already passed so far, adds 13% of GDP to the situation. So we're moving from 21 to 34. That's 10% higher than the highest peacetime increase we've ever seen, or the highest peacetime level we've ever seen. So that's an incredibly generous situation there. So how does that compare to other emergencies? Well, in the heart of the Great Depression, in the Great Contraction, the Hoover administration actually raised government spending from 3% to 6% of GDP. Then when the Roosevelt administration comes in during the New Deal, which is famous for actually expanding government during this time frame, they went from about 5 or 6% to about 11% of GDP. So they're not even anywhere close to the kind of increase that we've seen here. The Great Recession stimulus went from 21 to 24% of GDP, and actually we were running deficits of 10%, which is twice as large as any deficit that was run during the Great Depression. And so you can see that we've kind of expanded the role of government in the economy, particularly in response to these changes. So the next thing I want to point out to you is what happens with Pelosi's new claim. So what they want to do is they want to add $3 trillion stimulus through the end of the year. That would take federal outlays from 34% of GDP to 48%, almost half of GDP. So that's about $33,000 per person that they're going to start handing out over the course of this year. That's 8 percentage points higher than what we spent during World War II when we were fighting an all-out war and producing huge amounts of munitions. It raises the deficit to 33% of GDP. That's also World War II territory. And also going to put the federal debt from about 95% or 96% to about 130% of GDP. It's hard to believe we can sustain anything like that kind of situation. And so the next point I want to make is I want to suggest an alternative way to go. Because this is kind of like, let's throw money completely at everything we can throw at in the GDP. But we've got a big problem. We're going to have to live with this virus for at least another year or two. There's no expectations of a vaccine coming anytime new. We're finding some ways to treat it, but we're still in deep trouble. So we need to target this much more explicitly. And one of the key things to note is 80% of all COVID deaths are for people who are over the age of 65. Okay, and if you add in the people who are 55 and over, that's 92%. So really, this is hitting the older part of the population much harder. It's also hitting people who have comorbidities, like diabetes or heart conditions and things along those lines. And so what we really need to do is we need to get these people to self-quarantine. So, and some of these people are going to lose their jobs or whatever. And so what you want to do is those are the people that you want to target to get, say, 80% of their weekly pay and get covered for health insurance that they may lose. Because you don't want to have people in their 60s and 50s being in a position where they're losing jobs like that. Now, the other thing, though, is many of the people over 65 are already retired, and many over 55 have jobs that allow them to stay at home. So you're not going to spend nearly as much money as you did before. And you can administer pretty well with the IRS and the Social Security Administration. So the other thing is let everybody else go back to work and back to school. Now, one of the things you're going to have to do is, if it's more dangerous to do these kind of things, you're going to have to provide subsidies like COVID pay to healthcare and first responders, say $200 a week, which is a pretty generous thing. And it's based on a value of life of about $40 million. So you also want to cover the medical costs of people hospitalized by COVID. You want to ask people to go out and be kind and respect others by wearing masks and maintaining distance in public. And why I say you want to ask them rather than force them is that I think it's going to be much more successful with peer pressure. So mostly what's going to happen is you want to have businesses provide masks and distancing. You also want to have a thing, but almost everything that I've described there is probably going to cost about 1% to 2% of GDP rather than about 14% of GDP. And so that's a much different situation. So thank you for letting me talk about this.
Thank you so much, Price. So I want to start with some of the questions that we received from participants prior to the talk today. And several of them were about inflation versus deflation. So specifically, as the economy struggles to recover, can you please assess the risks of deflation versus inflation? And maybe Price wants to start with this.
Well, I can talk about it from the aspect of government, but I'm sure George has things to say about this as well, because he's a forecaster. One of the things to note is the Federal Reserve is basically the one who has most of the control of inflation. And so their role for a long time has been to maintain control of the money supply. This gives them control over interest rates and also allows them to affect the overall economy. And so up until about 2008, before the Great Recession, the Fed pretty much just kind of bought and sold government bonds. And did a lot of work to try to maintain inflation and keep interest rates relatively low. And then the Great Recession hit, and they gained all sorts of new responsibilities that they hadn't had before. And they started propping up the system. And so they nearly doubled the amount of assets that they held because they bought a lot of mortgage-backed securities. Now, what they've done this time is they've expanded things even more. They're buying a lot more stuff. They're making all sorts of new loans to Main Street businesses. That's brand new and all these kind of things. They're in a position where they can buy all sorts of municipal bonds. They're really trying to provide a tremendous amount of liquidity in the system and a lot of ways to prop up the assets. So I'll let George talk about inflation and deflation.
Okay. Happy to for the non-economists in the audience. Maybe a little bit of defining of terms might be helpful. So, inflation is a sustained, generalized increase in a broad range of prices. So that is not just one or two prices rising. That's, both sustained over a period of time and a generalized increase in, an average price level. And we tend to measure this with an average measure of prices that ordinary people for goods and services that ordinary people purchase, and they're weighted. So, housing and transportation, food and beverages, medical care and education, all those things go into this market basket, and the price changes of those goods and services gets weighted and averaged, and then we look at what happens to that average over time. If it's rising, we call that inflation. If that is declining, so that prices on average across that broad average are falling, that's what we call deflation. So just having one or two prices fall, like gasoline prices are down significantly, well, that's not enough for deflation. It has to be generalized and sustained for long enough. So, my view is that the dangers of a deflationary cycle are really big. That sets up a set of incentives for people to avoid spending because they believe that things are going to be cheaper in the future, and that can be really hard for a central bank to weigh against or to offset. It's much easier for a central bank, I think, particularly a central bank that's independent of the executive and legislative banks, to work with reducing inflation rather than trying to generate it. So I think deflation is probably the big concern at this point. I think there are concerns about inflation that we'll want to think about for the longer term, but at least over the past decade, the Fed has worked pretty well with its expanded balance sheet, and let's hope they can cope with an even larger one going forward.
Okay, thank you, George. So several of the questions that we received were industry specific, and one industry that we heard a lot about was the residential real estate market, and perhaps specific to Tucson. And so what impact do you think the COVID-19 will have on the residential real estate market, particularly locally? George, would you like to take that one?
Sure. The real estate sector is a really important one in Arizona, Phoenix, and Tucson. What tends to drive that sector is job and population growth. Obviously, the job growth is going to be a problem, and I think population growth will be reduced for a quarter or two. But the Arizona has, throughout most of its history, done a really good job of attracting residents from other states, and we particularly attract residents from California, especially Southern California, but really across the West. So I think in the even the short to medium run, we're going to see that population growth bounce back rapidly, and that will continue to drive the residential real estate market. There's a lot of talk these days that we might even do better in terms of attracting population, as perhaps, especially as Price mentioned, some older individuals who are particularly vulnerable to the impacts of COVID-19, maybe looking to live in less dense cities, more car-based cultures, and that may benefit Arizona, Phoenix, and Tucson as well in terms of driving some additional migrants here, maybe from markets that we haven't drawn so much from, such as on the eastern seaboard. But overall, the residential real estate sector has seen a little bit of a stop along with everything else, but I think that will bounce back fairly rapidly and do quite well in the medium to long run.
Thanks. Can you speak for a minute also about the healthcare industry? I think maybe one of the biggest surprises is that this virus has negatively impacted the healthcare industry, which you touched on a bit earlier.
Sure. That was one of I think the big surprises for most of us looking at how this might play out, say in January, February, is we have seen significant job losses in the healthcare sector. And what drove that was partly the executive order restricted elective surgical procedures that really affected hospital employment that wasn't directly related to dealing with COVID patients. And also, dentists were kind of locked down. They were only allowed to do emergency procedures, so job losses there. And people are looking to avoid gathering together in these groups and looking to avoid being too close to other people, including doctors. So we've seen this expansion of telemedicine. People are taking advantage of that while they can, and that means fewer nurses and administrative people need to be in the offices. So that has been an area that lost, I think, a lot more jobs than most of us thought was going to happen going into the outbreak.
Thanks. And how about the university? Price, would you like to speak to that? How do you think our university is positioned to handle COVID-19 and higher education in general?
Well, so the good news for our university is that the University of Arizona, the medical school and the public health people have actually been able to develop a test that's an antibody-based test or whatever. And the plan is to test everybody on campus. That's what Dr. Robbins says. I mean, we're going to run into some problems because, and every university is running into some problems. Everybody's announcing major shortfalls because people are worried about whether or not people are going to be able to come back to campus in September or in August in those kind of cases. And so, the school's got to find ways to be able to separate people. And so the universities talked about doing things like providing all sorts of stations for hand sanitizers, providing more space in the classrooms, maybe doing a mixture of online and live. It's going to certainly change the way we interact with people. I mean, I walked through the business school this morning to get to my office, and they already have signs on the tables there, stay 6 feet apart, just in small groups and things like that. So the one thing is they keep talking about all these graduating high school seniors are going to take a year off. And they keep saying, well, they're not going to come to school if it starts out being online. And I'm thinking to myself, God, if I'm a high school senior and I've been thinking about going to college all this time, and I can't go anywhere because no one's going to let me fly around and do things like that, I would much rather be out of the house halfway through the semester than be sitting in it. So I'd probably start out online. So hopefully that'll be good. Another factor that's going on too, though, that's hurting the University of Arizona in some ways is that there's probably going to be much less action from out-of-state students and from out-of-country students.
Right.
And in that case, we lose some income because we charge higher rates to those type of people. We should see, I would expect, an increase in in-state students if that's the pattern that's been going on. So it's going to be a challenge, but it's a challenge like for every other kind of business where you have to have personal contact.
Yeah, I think that Price is right there, and I would point out something for the local business people who are tuned in is that the University of Arizona is a big part of the local economy. So what happens here has broader impacts than just what happens to the university community. So hopefully we will have either no decline or only a small decline in enrollments, because how many students are on campus impacts local businesses, and as well the salary reductions that we may go through here in the coming years also have broader macro impacts. So the University of Arizona is a key part of the local economy. So local business leaders should take an interest and track the developments here at the U of A.
So let me say another thing too, is that like jumping on what George said there. So one of the things that might actually happen though is that people worry about coming back and living in dormitories where they don't have as much control of their environment. They may be more likely to be coming back for rental housing and things like that. So that could actually stimulate the rental housing industry in the area.
Yeah, good points. Good points. So we have some questions rolling in from our participants. The first one is, to what do you attribute the increase in stock market indexes when the Main Street picture looks so bad?
Well, I think that the stock market is designed to deal with, the goal is looking forward over time and what you expect to see. So things are currently very bad. You've noticed the stock market dropped, and like the S&P 500 dropped from like 3,400 down to 2,100 or 2,200, and then it came back up, and right now it's about 28 or 2,900. And I think what happened is that they originally panicked, and then they thought, well, actually, it's not going to probably be as bad as we thought. Now they did when Federal Reserve Chair Powell made his statement yesterday about needing more stimulus. You saw the stock market drop some. But actually, Alice, you should actually answer this question.
Yeah, I'm happy to take this as well. And I agree with everything Price just said. But the stock market is normally the first thing to react, and then the labor market follows. And so it kind of makes sense that we've already seen a bit of the V that George was discussing earlier with the stock market reaction. And to Price's point, perhaps it was an overreaction in the beginning, and then we saw the government step in and provide stimulus money, and the market seemed to like that. And now the movements are very much related to how the government is reacting on a day-to-day basis. But the stock market should always be viewed as a long-term game, right? Based on long-term valuations. So the next question is,
can I add that? As an economic historian, a lot of people like to use the stock market as a predictor for what's going to happen to the overall economy. So you need to listen to what I say carefully. The stock market drops have predicted 14 out of the last 5 recessions.
Right.
Stock market drop has led to predictions of 14 recessions. We only had like 5.
Right. Thank you for that. That's a fun stat. So the next question actually has to do with philanthropy. So what impact do you see COVID-19 having on philanthropy? Which of course is important for the university as well, right?
Yeah, it will most likely generate a short-term drop. High rates of uncertainty about the future can make people less willing to make philanthropic contributions. A big drop in the stock market can create wealth effects that may reduce philanthropy. But you also want to keep in mind that as people see greater need all around them, that can produce a little bit of a countervailing effect, and that maybe they're not the big dollar contributions that we might otherwise see, but a lot of little contributions can add up significantly as well.
I agree. Hopefully there's a sentiment that we're all in this together. We're all impacted, if sometimes unequally, but perhaps philanthropy could actually benefit from that.
So I think, go ahead. Let me say something. I say one thing to note is internationally, however, Americans are much more philanthropic than most of the other economies around. And particularly if you compare us to Europe and things like that, they rely much more upon government kind of services and things like that. Whereas the United States often relies more, to a greater extent, on private charity.
Private sector.
So international payments tend to be much bigger than most other countries.
Great point. Yeah. So the next question is, in general, what industries, businesses, and companies do you believe will thrive in the new market? Are these companies with high liquidity, a sound business model, low contact? So perhaps they're already set up as e-commerce online. So I think the broad question is, which companies do you view as being able to thrive and survive and then thrive in our post-COVID-19 world?
Yeah, in the short run, I would, we're obviously seeing the grocery stores, pharmacies, the warehouses, online activity in general, I think is doing pretty well. I think there are going to be some interesting impacts on commercial real estate, particularly if this turns out, as Price has mentioned, it's more like a slow burn where we're trying to protect the vulnerable populations and then live with the virus being out there for a significant amount of time. We may need to see some repurposing of some commercial real estate. Hotels, if it takes a long time for travel to get back to where it was, we may need to see, think about repurposing of hotels. Shared workspace, the open workspaces that were really all the rage. We're not sure how that will play out going forward. It may change residential real estate in terms of the high density apartment buildings may become significantly less attractive going forward. But again, it all really depends on how the virus plays out. If turns out that we have control of the outbreak, vaccine effective therapeutics in the relatively short run, there may not actually be big impacts in that way.
So I'd like to add a couple of things there too. So one thing about this is when you have downturns like this, even companies that are doing poorly, a lot of times what happens is they may go bankrupt or they're struggling. And so people can come in and purchase them and all of a sudden their capital costs and their fixed costs are much lower. And so you can actually get pretty good deals. Kind of sadly, you can get pretty good deals at this time and then you see a big growth in the industry later. Because retail's come back eventually. The big question is, when is it going to come back? So there could be
and what it will look like, right? What it will look like
exactly.
when it comes back.
And you're going to have to make changes. And we've seen that, but we've seen changes a long time ago. Like I had a student who actually wrote a dissertation about the effect of the automobile on retail sales back in the 1920s and the 1930s. And it drastically changed the retail sector by having automobiles. Instead of people going down to the local store and all the goods being behind the counter and people handing them to you, instead, you could carry a lot more with the automobile, and so they went to the kind of open grocery store models that we have now during that time frame. So technological changes can lead to big things, and sometimes shocks can do that as well.
Yeah,
absolutely.
There's probably
Go ahead, George.
a healthcare angle here too, right? Healthcare jobs got a bigger hit than we thought they would in the short run. I think that will also be one of the first sectors to come back, particularly as individuals perceive the outbreak to be under control. You know, that healthcare demand is something that we really want. We want or need those elective surgeries and want to visit the doctor's offices. You pretty much have to go back to the dentist if you want to get your teeth fixed. That can't be done via any app that I know of. So, we'll be going back to those things, I think, relatively rapidly.
So to piggyback on this, go ahead, Price.
So I'm sorry. So one of the worrisome things about this as well has been, and this is for health purposes as well, is the number of people who have delayed checkups and all sorts of things related to their own problems. And so the estimates of excess deaths, where they look at how many more deaths they have this month relative to what it was a year before, has gone up a lot more than the number of COVID deaths. Now, some of that may be undercounting of COVID deaths, but some of it also is because people delayed things, and so therefore they haven't been getting the proper treatment. So bringing back the healthcare people, I think, is going to be very helpful. I had to go to the dermatologist, but they've got all sorts of practices. I sat in my car till it was time to go in. Everybody was masked. I had wipes on my hands. They had wipes on their hands. So they were doing a pretty good job of keeping it clean.
No, great point about the unintended consequences of kind of stopping all of the what's considered non-essential healthcare. To piggyback on this conversation, another question we've received is, do you anticipate major structural changes in certain industries to result from the crisis?
Yeah, I think in the short run, as Price was mentioning, we'll be working on ways to social distance so that since the virus is still going to be out there, we can keep the transmission rates as small as we can with the economy opening back up. So the way that the kids and even the faculty and staff move around campus and the buildings will change. Restaurants and bars and movie theaters, when they open up, that will be different, at least in the short run. Again, this will all depend on what people feel. How safe do they feel going back into these environments? Will they want to go back to more crowded environments really rapidly, or will they want to see the social distancing maintained for the longer run?
Yeah, so I actually think that part of the thing is going to happen. I think the last industry that's coming back is sports and concerts and theaters and things along those lines, because people don't want to go into big crowds in those kind of settings. And also, if you've still got the possibility of an epidemic, that's the last thing you want to have happen, is to have big crowds. I mean, one of the biggest problems in Italy and Milan was that they had a major soccer match that infected a large number of people. A large amount of people from Spain, which was the opposing team, were there, and they got infected and went back. So these big gatherings or whatever, I think, are going to be the problems. And so we're going to end up watching a lot of sports and stuff on TV.
Yeah, and I think the airline industry will be an interesting one to watch. And this is something that we're tracking on our Arizona's Economy Online magazine at azeconomy.org. We're tracking these weekly indicators of how people are thinking about maintaining social distances. And one of the things that we're tracking is passenger throughput at TSA checkpoints. And that's down about 100% from where it was before the outbreak began. So, just asking myself, when am I going to how fast am I going to be looking to get onto an airplane with 150 other people literally rubbing elbows with them? And I don't know. I think my car is looking pretty good for the.
I agree. I think a road trip is on tap for the summer. So the next question is, what will the long-range impact be on the economy of the nation's current taste for low taxes, combined with this extra surge in expenditures that will become part of long-term debt? So think about balancing low tax rates with high expenditures. How long can we sustain that, I believe?
Right, and so we have this problem, and so we're going to have to find a way to repay. So we've actually, in like 2007 or 2006, the federal debt was about 35% of GDP, and after this year, it's probably going to be about 120% of GDP. And that's after World War II. We really haven't been paying these debts off. We're not the only ones, though. There are all sorts of countries. I mean, Japan is at like well over 200% of GDP is in their national debt. And so you've got these big problems, but it's also going to be a problem at the state level. And so the states have been asking the federal government to help them do this. There have been big fights over whether or not the federal government should be helping out with pension programs that were just poorly designed and haven't been fully funded by the states for decades.
Okay, so we have another question about trade with Mexico. So what are your thoughts on how the border closures will affect the regional economy, Nogales, Tucson, Southern Arizona in general? And what are your thoughts in general about the pandemic's effect on the border region and trade with Mexico? Maybe we already have some data on that, George.
Yes, as part of the work that we do here in the Economic and Business Research Center, we run a website devoted to helping people understand Arizona's role in border trade. And that's available at azmex.eller.arizona.edu. And, we have the data for March, but, March is so early in all of this that you don't get the full impacts there. But, with the restricted movement through the border, that has had a big impact on the border communities who really rely on those daily crossings of individuals to support their hotels, motels, restaurants, and bars, the retail activity in that region. It's probably also impacted retail trade up here in the Tucson area as well, particularly as we start to open up. But the border is still pretty well locked down to that non-essential travel.
Do we have a sense of when when trade will begin to flow again?
Hopefully soon. There will be. It will be difficult to start up the U.S. auto production without opening up more generally across the NAFTA region. So, we'll have to hope that things are going well in Mexico and that they're able to increase the production of the parts that we need to start pumping out cars at a rapid pace. So. For the latest data on that, visit the Arizona Mexico Economic Indicators website often, and as soon as we have that April data, then we'll have a real hard number sense of what the impact was on trade.
Yeah.
Thanks.
This is a spot where the U.S. government's actually gotten involved in this. They're actually putting all sorts of pressure on Mexico to reopen up a lot of their manufacturing to allow us to reopen as well. So we tend to put a lot of pressure on everybody else, not so much pressure on ourselves.
True. So the next question, Senator McSally has said that the next stimulus bill should not be a, quote, cash cow for cities and states. Where should stimulus money go? Thoughts?
My suggestion for that was kind of going back to this plan. I really think that if you're focusing on stimulus money, you need to focus the money towards the places where you're saving lives in COVID. One thing I didn't mention is we really need to get to work tracing people and doing things like that. And I don't think tracing people through apps is a good way to do it. It kind of creates all sorts of privacy problems. A friend of mine and I wrote an op-ed about this where we suggested that have people do it where you're using phone calls and things like that. The public health people discover that someone's got a disease, got the COVID virus. And then what you do is you contact someone who's working for you, or might be someone who actually volunteers to call people up, call the contacts up, let them know that this person has the disease, where they can get tests, and where they can do those kind of things. So this is a case where I think low tech is actually much better than high tech because of the privacy issue.
It's true. We always have to counterbalance it with privacy. So the next question is about the impact of a drastically reduced revenue stream and tax dollars on the states and local government. For example, how will this affect their ability to, say, fund public education, Medicaid, long-term care, public safety, et cetera?
Well, it's going to have a significant impact on state revenues. Arizona was in good shape going forward. We have about $1 billion in the stabilization fund. State revenues were rolling in at an excellent rate before the outbreak began. in what passes for good news these days, the sales tax revenues for the collections for April, which represents sales activity in March, declined, but declined less than expected. So that's good news.
We'll take it.
Yeah, we'll find out what the results are in the next month or so for the April retail activity. But there's some data that I track out of the Opportunity Insights website, which tracks high frequency data on credit card transactions. So you get an idea of both credit and debit card transactions, and that gives us a sense of how consumer spending is evolving. And the data there is for state and local areas, including metro areas. And what we see in both Phoenix and Tucson is that the purchases that are card-based, are down in the 25 to 30% range compared to where they were before the outbreak. And the expenditures at restaurants and hotels are down 60% or so. So clearly a big impact on sales tax revenues, and the sales tax revenues are really important for the local governments. So there's going to be a big hit to their revenues in the short run. It will just depend on how the recovery plays out as to what the longer term budget impacts are going to be like. So we'll find out more about that as we go into April and May. So
this is an area the federal government actually does have a role to play. I think the big worry is you don't want to bail out Illinois' pension program, but what you want to do is you want to, a lot of states are spending a lot of money on hospitals, opening up convention centers to have enough beds, doing a wide variety of things like that. The 2008, 2009, 2010 stimulus, actually, they talked about shovel-ready projects that made you think that they're going to spend a bunch of money on building roads, but actually a big chunk of that money went to state and local governments to help make sure that universities survived and budgets held up. Federal Reserve's ability to purchase the municipal bonds actually is going to help keep the bond market up and allow interest rates to stay relatively low. One of the things here is, you want to have people have forbearance, and that's what the Fed's ability to do that is really important. When they tried to solve the housing problems of the Great Depression, one of the key agencies at that time was the Homeowners Loan Corporation. And they bought up all these loans. And the reason that this thing worked so well when they refinanced loans is they waited a very, very long time before they'd foreclose on anybody, like 2.5 years. So that ability to provide forbearance is going to be very important from the federal government and also from the Federal Reserve.
Okay. The next question hits home. It asks whether we foresee a permanent contraction in higher education, and are there historic precursors that can guide us to answer this question?
Yeah, that's a good question. We're all thinking about that personally, I think, these days.
Right.
Higher education more broadly has faced some headwinds, just demographic headwinds. You hear a lot about these projections that large number of universities, particularly small ones, are headed for shutdown. So even before this, there were some headwinds to be concerned about and thinking about. But thinking forward, higher education is a key part of the human capital production for the nation and really for the world. So we're going to be needed, and the U.S. cannot be competitive. We can't drive forward the innovative activity of the U.S., which really drives our standard of living up in the long run. We can't do that as well if we don't have a well-functioning higher education
system. Mm-hmm.
This is one of the areas where we have a big comparative advantage over the rest of the world, because we've actually trained a large number of people around the rest of the world. Mm-hmm. We've actually, this is where immigration policy mixes up quite a bit, because one of our major exports has been our ability to provide education services to a large number of people. And a lot of times we've been able to be very successful at actually kind of grabbing the top students and keeping them in America. And then, we send other people back, and being able to have that conversation actually allows the international community to be much more innovative. It really, innovation requires a lot of your ability to talk to a diverse range of people. And so that means the more international you have, like internet universities and the interactions in the scientific communities, that's a central feature of success in this area. And so we need to think more about our immigration policy in particular, about trying to make sure that we're bringing in innovators. And one of the ways to do them is to bring them in and educate them and then keep them.
I agree. So the next question is interesting. It asks, is there a place for creating a service corps that would produce both employment and service to society? Is now a time to do something like this, or would this solve our unemployment issues?
Well, so I would suggest on this, so I started my career mostly the last 20 years have been studying Roosevelt's New Deal. And so a lot of people talk about the New Deal. And so I wrote this op-ed. One of the things that would be useful is currently we've got a lot of people who are receiving the $600 in unemployment. I mean, it'd be nice if they'd be willing to volunteer. So under the New Deal, if you actually worked in these programs, you would get paid, but you also worked for it as well. And so at least during the temporary phase where we have the unemployment insurance at $600, it might be useful to have a lot of volunteers. We have about 27 million people who are going to receive it. So if you can get like 100,000 or even 1 million volunteers to work 10, 20 hours a week to help on this, I think that'd be useful. After the $600 goes away, then you want to hire people or you want to create the servicing as well. Volunteerism is a very important part of our society and has been for a long time. So I think that's something that's useful to do. But let me make one other warning though. You don't want to go out and have some new program where we're paying people to do all sorts of new things and stuff because really we've got a huge problem going on in the private sector right now because we've cut off all these industries and stuff. We really need to get those people kind of in a position where they can go back to work and do those kind of things. And so I think that's central, but we've got to do it safely.
Great. We have a question for you, Price. So to Professor Fishback's prescribed course of action, should remote work become softly mandated to avoid a relapse or second COVID wave?
I don't know if it was softly mandated. I think that most people can make that decision for themselves. I mean, the university, when they're talking about going back, they're saying, well, look, if you don't feel comfortable coming back, then you should go ahead and still stay at home and still work in those kind of things. I really want that to be the individual's decision as much as possible because we don't really know what most of these jobs are like. And so trying to come up with a soft mandate to tell everybody to do the same thing is probably not a very workable solution. That's one of the reasons why our responses to epidemics in the United States have been basically state and local governments for the last 300 years. That's largely what's going on here. Because they just know much better what's going on. North Dakota looks drastically different from Tucson. And it looks drastically different from New York. And they have a much better sense of what's going on there. Now, the one thing you have to have the federal government do is to find effective ways to support those systems. And I think one of the biggest mistakes the Trump administration made was not going out and purchasing a lot of the PPP gear, a lot of the health gear, as a monopolist buying from a lot of these people rather than forcing the states to actually go out and do those purchases. That's a place where the federal government actually could play a big role.
All right, so we are running out of time here. We have a couple more industry-specific questions. A few of our participants want to hear about the cruise industry and the gaming industry. Will they ever recover? Is anyone going on a cruise this summer? No.
Yeah, probably not this summer, but there is a desire for these services, right? So once we have control over the outbreak, whatever that looks like, I think all that stuff is going to come back in one form or another. It may look a little different, it may feel a little different, but if they can survive long enough to get to the medium and long run, then people enjoy cruises and people enjoy gaming and that will again be part of our lives, I think.
Okay.
So I have a suggestion about that. So I think that this is one thing, when I was a graduate student and when I was assistant professor at the University of Georgia in the 80s, no states had like lotteries or anything along those lines. Almost nobody had casinos and things like that. And then they opened up the whole industry. So this is a case where you might actually, states might start to allow people to gamble online more than they did before. You're already opening up sports betting for online gambling and stuff, so you might see those kind of things going on. It's not quite as exciting as being there shaking the dice and rolling them and stuff, the roulette wheel, but a lot of people seem to like to gamble. Then you got to worry about Gamblers Anonymous or gambling, people who are obsessed with gambling.
There are always unintended consequences, right?
Yep,
Yes.
No matter what.
Well, I think we probably should stop there. We thank you so much, participants, for tuning in. A huge thanks to Dr. George Hammond and Dr. Price Fishback for their time. And we wish you all a good afternoon, and we'll continue the conversation offline.
Thank you, Price, George, and Alice. I know everyone appreciates your insights as much as I do. Thank you, everyone, for tuning in today. Stay safe, and as always, bear down.